You're listening to an African Elements top news story for July 7th, 2025. Please visit our website at africanelements.org for more daily news. Federal cuts harm Black communities. The Trump administration has established the Department of Government Efficiency, known as DOGE. DOGE's mandate is to streamline government operations and cut federal spending. It has targeted grants across multiple agencies, including Health and Human Services. The administration claims these cuts eliminate inefficiencies and reallocate resources. The Department of Health and Human Services has listed dozens of grants for termination. These include research awards and funding for community health services. State and local health departments face the rescission of over $11 billion in COVID-era grants. This funding freeze threatens job losses and program reductions nationwide. Programs for infectious disease control and vaccination outreach are at risk. Laboratory capacity and emergency preparedness grants have been slashed. Chronic disease management and health promotion activities face steep cuts. Universities and research centers will lose more than $1 billion in grants. Institutions such as Columbia, Duke, and UCLA are affected. The New York City Health Department stands to lose $100 million. Los Angeles County Public Health loses over $45 million in outbreak funding. These cuts undermine core surveillance and community outreach efforts. Black and marginalized communities bear the brunt of these reductions. Marginalized groups include racial minorities, low-income residents, and people with disabilities. They already face barriers to health care and poorer health outcomes. Layoffs at the CDC have disproportionately affected Black and marginalized staff. This loss of expertise and cultural competency hinders public health equity. Violence prevention and HIV research have seen deep funding cuts. The Minority AIDS Initiative has been eliminated entirely. The Ryan White HIV/AIDS program lost $239 million. Dental services and training centers for HIV care are on the chopping block. Over 200 NIH HIV research grants have been canceled. Scientific progress in prevention and treatment will suffer. The CDC's Division of HIV Prevention may be reorganized or eliminated. This threatens essential programs combating the epidemic. Specific cuts include the New York City Health Department lost $100 million. Los Angeles County Public Health lost $45 million in ELC funds. The CDC in Georgia lost $334 million. Nonprofits like the Center for Black Women's Wellness lost $438,000. BLKHLTH Inc. faces a nearly $500,000 shortfall. These losses jeopardize vaccine equity and community programs. Internet access grants for rural and Black communities were canceled. Georgia's $22 million Digital Equity Capacity Program was abruptly cut. This would have expanded high-speed service and telehealth in low-income areas. A comprehensive plan to improve connectivity in McIntosh County has been shelved. Such digital divides harm elders, students, and families in rural communities. Long-term effects include a resurgence of preventable diseases. Health disparities will widen as public health infrastructure weakens. Scientific research will slow and community well-being will decline. States and nonprofits may seek private or local funding to fill gaps. However, these efforts rarely match the scale of federal support. Rural areas with few resources will be hardest hit. The administration frames these cuts as fiscal responsibility. Critics argue they dismantle critical public health systems. They weaponize the federal dollar against vulnerable populations. Cuts to HIV/AIDS and public health mirror broader disinvestment trends. Black, brown, and marginalized communities lose vital services. The erosion of prevention programs undermines decades of progress. The human cost of these decisions will echo for years. Communities striving for equity now face new obstacles. The fight for health justice continues amid federal rollback. African Elements will keep covering these developments. Copyright African Elements.